Medical Unit Huddle for September 20th. I'm Ricky, your nurse manager. This week for patient experience, I just wanted to recognize the amazing work that everyone is doing. You will see in this week's NRC Monday email that we have a couple of scores that are at 100%, and that's pretty impressive. We also had Jesse, our CNO, rounding and saying what a good job everyone has been doing, and then also recognized us in one of the morning huddles. So that was pretty cool to get recognized by the CNO, and that speaks volumes. We have the system looking at us and how we are impacting MCR scores, so that's amazing news, right? So go check that email out as well. Okay, a couple things. Nova strips. Please make sure that you guys are putting the full expiration date on the quality control vials, and then which is 180-day expiration date for the strips, and for the quality control vials it's 90 days. They did find one the other day that was dated for August 30th, so obviously that was well past the expiration date, so make sure that you guys are getting those dates on there. Storyboard, easy for me to say, storyboard went live this week. Email me your feedback. Let me know what you're thinking on that. I have kind of played around with it. It seems to be fairly easy to navigate once you kind of figure out where things are at. I think with anything, we kind of are getting some feedback that people aren't crazy about it, but I think it's just getting used to the navigating piece of it. Otherwise, I think for me it's been okay. But yeah, email me and let me know what you think, and I can pass that information along. Let's see. On repeat, I would like to mention that if you don't have a patient on tele, put them on Visi. And I will say it again. I feel like it just needs to be like, I'm gonna put it on repeat. Maybe I'll just play it like throughout the unit, like put your patient on Visi. So please make sure that you guys are doing that. This one makes it super easy. We have the virtual ICU who is watching all of our patients in the background, and they can see those vital signs. Even though you're not acknowledging every single one of them, they do a really good job of monitoring that and looking at trends. So that's one benefit there. And then, let's see. Yeah, that. And then, so I think one of the awkward things that's coming up is, like, if you have your patient come off tele and then whoever's taking it off isn't putting the patient on Visi right away, so it makes it kind of awkward for that next person coming on. When they're putting it on, they're like, well, the last person didn't put this device on me. That just doesn't set up the next person for success, so make sure that you guys are doing that as well. And then of course, if you have a patient who is on the continuous pulse ox, depending on what we're monitoring them for, we might ask the physician if we can put them on the Visi device. At least the alerts are going to your phone, and if we have patients that we're concerned about, it's continuously surveillancing them. I think that's all I have for that. So I'm going to give you Carly's updates so you know that we're meeting every week for our L's and reviewing those. So here's our update, our medicine service line huddle takeaway for the week. Heparin drip dosing is complex, and due to the need for max dosing limits, you may need to change from units per hour to units per kilogram per hour after the first 6 hours of infusion. Both are calculated based on the patient's weight, but if a patient weighs more than safe dosing for units per kilogram per hour, then the infusion profile starts in units per hour. This is all in the order information. Please pay special attention when switching from units per hour to units per kilogram per hour, as you have to actually do the math calculation and you have to turn off the channel for this switch. Please call pharmacy to help with the math calculation if you have any concerns. Pharmacy is also revisiting this process. This is true for both the cardiac and standard heparin drip dosing, although the max dose is different for each infusion. Well, if that doesn't cause some confusion, I don't know what. But anyway, you should be doing that 2-person and just making sure that all of the calculations are accurate. One other recommendation I would say is sometimes there's a lot of family or friends or visitors in patients' rooms, and when we're trying to do medications that require that dual handoff, sometimes it's nice and it's okay to ask for them to either maybe be silent while you guys are doing that handoff, or to have them step out and maybe just explaining that it is really for the safety and you're doing that dual sign-off for a purpose. So just something to think about there as well. Okay, so a little bit this week, we had Chandler leave us, so we're so sad. We will miss you, Chandler. And then, of course, Becky had her baby shower this weekend as well, or this week as well. And then we don't have anyone new starting this Monday, but the following Monday we have a couple new folks. I'll save that for next week's huddle video. Otherwise, I encourage you to check out the crew for any staffing updates. And as always, check your email because I appreciate that. There's a lot of information that comes out there at least once a week that is in our unit guideline or our professional practice. So please do that. I say a lot of great things. And that's all I have for now. So I'm going to turn it over to your charge nurse for any current patient safety quality concerns. And you guys have a great shift.